Hi, my name is Brigitte Brantley. It's November 29th, 2013. This is for my abnormal psychology class. Dr. Watson is my teacher. The journal article I'd like to share with you today is entitled Psychosocial Interventions for Bipolar Disorder and Coping Style Modification. Similar clinical outcomes, similar mechanisms, found in the Canadian Journal of Psychiatry 2013. This article attempts to appraise the effectiveness of coping styles used at the onset of mania symptoms within bipolar disorder. The article takes a comparative view of psychosocial forms of therapy used in the treatment of bipolar. Cognitive behavioral therapy, also known as CBT, and psychoeducational therapy were evaluated using a random controlled trial of 119 participants, with bipolar 1 being at 73.1% and bipolar 2 being at 26.9%. They were split into two random groups and given either 20 individual 50-minute sessions or 6 didactic 90-minute sessions. Both forms of therapy were found to be effective in the increased use of stimulation reduction and problem-direct coping styles in response to precursory manic symptoms, with no change in those that would seek professional help. As to the evidence of those that would seek professional help, while it's noteworthy, it should not be used as a measure, as all participants within the study were already under physician's care. The study also found that psychoeducation therapy was more cost-effective than CBT in its implementation. However, CBT was more effective than psychoeducation therapy in its reduction of placing blame and denial, but did not improve clinical outcomes. This article was concise and unmuddled. The direct approach taken in explaining this study was refreshing. In examining early onset symptomology of mania within bipolar disorder, its need for early identification and treatment, the study was able to provide therapeutic data as to the effectiveness of treatments. It is because bipolar can be such a recurrent and debilitating disorder. Any insight given to improve outcomes within the therapies used is an invaluable tool. This study provides such information. For example, mania and its severity correlates with the severity of depression and anxiety within bipolar, and as the study shows, in its therapeutic path as well. By calculating the cost effectiveness and the compared therapies, as well as elemental information as to the components within each therapy, the study provides the necessary information to tailor treatments to the price point and needs of individual patients, with the goal of improved outcomes and sustain an effective program overall, cost-effective program overall. The information gathered in this study was from participants who were already seeing physicians at the point of enrollment, making them those who already sought professional help, thereby making the element of analysis moot. Cognitive behavioral therapy and psychoeducation therapy overlap in their treatment parameters, with CBT including a form of psychoeducation treatment. This knowledge will lend itself to the assumption that CBT would be a more effective form of treatment, but it was not scientifically proven. It was not stated if the therapies or part of the therapies would be equally effective in treating early onset mania in bipolar 1 or 2 or both. What was the relapse rate when early symptom identification was achieved or treated? Was the outcome of the study influenced by the fact that the participants had already sought help and had prior information and experience with this disorder? It would have been more informative to have had the findings that supported an initial form of treatment for those being just diagnosed. This would have provided therapists with a possible jump in efficacy when treating this disorder by knowing initially how to approach it. That's my presentation. Thank you and have a good evening.